Hello everyone, it's Angelika Kargulewicz, clinical nutritionist, and in today's episode we will talk about body hydration, why water is so important to our body and how to hydrate ourselves in a best way. And also asking the question, for example, is it really helpful to add salt to our daily water? If you are interested in these questions, please stay with me today. So water for sure is important for our biological processes. It creates the environment in which all the life processes take place. It is important to remove all the toxins from our body. It participates also in digestion, for example by moving fecal matter. And water also regulates the body temperature. Its body content is between 45 to 75%. The lowest water content we can find in adipose tissue, only around 10%. And that's why obese people usually present very low water body content. On the other hand, our sweat consists of up to 99% water. Its body amount is relatively stable. A positive one we can find in pregnant women and children, while a normal, regular human being usually presents a zero balance. This is the balance between the amount taken in through the food and drink and also the amount excreted through the kidneys, lungs, skin and gastrointestinal tract. The deficiency of the water in the body, so-called dehydration, has a very serious consequences for its functioning. For example, the dehydration of the 2 to 3% reduces the physical performance, while 5 to 8% may cause some serious nervous system disorders. And with the dehydration of 20%, death occurs. Water demand is increased by high ambient temperature and reduced humidity. And in that kind of the situation we can see like increased excretion of the water through the skin. But also our water demand is increased while we are staying at low temperatures but high altitude. Another reason for an increased demand for the water is diarrhea, but also increased diuresis, for example caused by medication, and increased strenuous training, physical activity. Depending on type and intensity of exercise and also environmental conditions, athletes can lose between 2 and 12 liters of the water per day during the training. An important factor is also the energy value of the diet. The higher energy value of the food, the greater need for the water, because larger quantities of the nutrients needs to be metabolized. And when it comes to protein, the greater amount of the protein, the greater also diuresis. And very similar effect we can observe when it comes to alcohol consumption. And what are the signs of dehydration? So chronic deficiency of the water can promote dry skin, mucous membranes, urinary tract infections and also kidney stones. People who consume less water, less amounts of the water as a standard, are also found to have an increased risk of bladder cancer development, and consuming less water is also a risk factor for depressive disorders development. And what about an excess of the water intake? Could it be dangerous? Of course, it can be a burden on the kidneys and heart. Excessive intake of the water without proper excretion of the water can result in edema, cell damage and also in extreme cases in a coma. And what are the causes of excess body water? For example, excess of the sodium ions in the body, but also large intravenous fluid supply and also the reduced excretion of the water by the kidneys as occurs in the end-stage renal failure. However, the adverse effects of excessive fluid intake in healthy individuals are quite rare, because their body is able to remove the excess of the water, so thus the proper body-water balance is maintained. Well, to be honest, a risk may arise with a single intake of large amounts of the fluids, well above the maximum water excretion by the kidneys of 0.7 to 1 liters per hour. And the question is, what kind of water should we choose? And the answer is that if a standard diet covers all the necessary ingredients, including magnesium and calcium, an ordinary filtered tap water, which is very similar to spring water or low mineralized mineral water, can be used. It is worth mentioning on this occasion that mineral water differ in their mineral content, and so we distinguish very low mineralized water, and they provide less than 50 milligrams of minerals per liter. We also distinguish low mineralized water, and they contain less than 500 milligrams of minerals per liter, and also moderate mineralized water. They provide around 500 to 1500 milligrams of the minerals per liter, and also highly mineralized water, and they provide more than 1500 milligrams of minerals per 1 liter. Within the highly mineralized water, we can also distinguish water which are high in magnesium, and usually they provide around 50 milligrams of this mineral in 1 liter, and this is a good option for people who want to support their mental function. And another kind of highly mineralized water is water which provide also calcium. Usually the amount of the calcium is around 150 milligrams of this nutrient in 1 liter. And this is a good option for people whose diet is deficient in this mineral, which is quite often in nowadays society. And it is worth to mention that both calcium and magnesium occur in these waters in ionized form and are therefore well absorbed. On the market we can also find alkaline waters which are used for nephroprotective purposes because they may slow down the decline in the glomerular filtration rate, and also are very advisable in hyperacidity because they alkalize the stomach content, but also in diabetes mellitus because they can lower the glucose serum level, and also are advisable in alcohol intoxication. Alkaline waters usually provide bicarbonates in an amount of approximately 600 milligrams per 1 liter, but alkaline waters which provide more than 1000 milligrams of bicarbonates in 1 liter have the most beneficial effect. And what is the contraindication when it comes to using alkaline water? So the contraindications are acute gastrointestinal conditions like peptic ulcer disease. And sometimes people ask whether carbonated or fizzy water is advisable, is it healthy to drink such kind of the water? So the answer is that, to be honest, carbon dioxide, which is contained in those water, can have very beneficial effect. For example, improves digestion, but also have antibacterial and refreshing effect. But is this water, carbonated, fizzy water, a good choice for everyone? No, unfortunately not. For example, this is not recommended for the people with gastroesophageal reflux, or for example for people with inflammatory changes in gastrointestinal tract, and also for people with flatulence, or for example for people with disease of the throat or vocal cords. And a separate but very interesting issue is connected to healing waters. We have even such kind of knowledge like cryotherapy, which is a drinking cure. And it is worth to mention that medicinal waters cannot be used as thirst quenchers. They should be used in specific, usually low quantities, because excessive quantities of these waters can cause adverse effects, for example, in the form of diarrhea. Medicinal waters are used for treatment. For example, waters used for treatment high in bicarbonate, chloride and sodium. They are advisable for people with duodenal and gastric ulcers, also for people with reflux disease, and also in functional disorders of biliary tract. They also lower the level of cholesterol and glucose, but due to the high content of the sodium, they are not advisable for people with hypertension. We distinguish also water used for treatment high in calcium and magnesium, and they are advisable for people with urinary tract and kidney disorders. We distinguish also water used for treatment high in calcium and bicarbonates, and they are used for treating gout and urological disorders. Another type of medicinal water is sulfate water, which contain more than 250 milligrams of sulfate in 1 liter. And this kind of medicinal water is advisable for people with gallbladder disorder, digestive disorder, but also for metabolic issues. For example, they are beneficial in the early stages of diabetes mellitus. We distinguish also so-called salt waters. They contain around 3 to 15 grams of sodium chloride per 1 liter, and they are advisable for people with constipation, but they are not recommended for pregnant women and also for people with cardiovascular and renal failure, because they contribute to hypertension and also edema. And also the same situation here when it comes to drinking water with added salt. If we are not the athletes who exercise in a hot conditions, or for example if we do not experience very severe diarrhea, this kind of water is not advisable. And the worst choice when it comes to waters is choosing flavored waters, which often contain sugar, glucose, fructose, corn syrup, and also preservatives and colorings. So this is the worst choice we can choose. In conclusion, let's remember about proper hydration of the body. And for the most healthy man, it is at least 2.5 liters of the fluids per day. And for most women, at least 2 liters of the fluids per day. And let's also remember that the fluid balance includes not only water, but also coffee, tea, juice, or different types of infusions. Water is essential for various biological functions like metabolism, toxins removal, and also temperature regulation. Dehydration can lead to serious health issues, while excessive water intake can strain our heart and kidneys, causing edema. And also remember that medicinal waters should be used for specific conditions, usually in a very controlled amount, in order to avoid the adverse effects. If you liked my video, please leave the thumbs up and subscribe the channel, and see you soon in the next episode.